Is that yours or mine?
4:04. I'd like to call this Personnel and Human Services Committee meeting to order, please. Roll call.
Ryder.
Excuse.
Duranta.
Here.
Krieger.
Yes.
Gibb.
Here.
Coonan.
Here.
Lutz.
Here.
Harris.
Here.
Warren.
Minutes from the 8/15/17 meeting. What's your
Move to
pleasure?
receive.
Support.
Motion and support. Any discussion? Changes? All those in favor?
Aye.
Opposed? Motion carried. Public comment, public input. Anyone from the public wish to address today's meeting, please come forward. Thank you very much. Petitions and Communications from our health officer. Amendments to agreements with Saginaw Valley College, Saginaw Valley State University for Bay Community Health Clinic, formerly the University Clinic, seeking approval of agreements.
So support.
Motion and support. Any discussion? All those in favor?
Aye.
Opposed? Motion carried. Whoop, discussion. Joel,
Now we got Joel give us a little background.
Okay.
We'll go on with this.
There were 3 grants. The original first grant, which was the Advanced Nursing Education Program grant, that was scheduled to end on June 30th of this year. There was a bit of carryover, so the university has asked for an extension. They received one from the federal government, and that 41, which actually should be 51, so I'd like to amend the request. That 41,000 is the leftover funds that will help for that. We're in addition to that, we're billing for services currently through that grant, through the clinic. The second carryover was there was a grant that was written by Saginaw Valley to expand services to include mental health and integration of mental health services, and that's one of the partnerships that we have with Bay Area Behavioral Health. And then the third amount was part of a grant that was actually written by Wayne State University to expand coverage in the clinic 1 day a week. And there was a great deal of unspent funds. And so we're anticipating that with approval from the federal government that those funds will be coming as well.
So, you got 3 grants and you're performing 3 different types of services, mental health and Wayne State.
Well, I guess the best way to surmise that would be it is a primary care clinic staffed by nurse practitioners with social workers. So there's an integrated aspect of mental health services and counseling that's involved with that, as well as other social work services where we try to match folks that have needs that can't be met in the community to their needs or to resources that are available throughout the community. We've got a pharmacist on loan from Ferris State University that works in consultation with both behavioral health and the nurse practitioners so that they can manage medications for the people that are involved. And you have to remember, this clinic primarily serves people with multiple chronic conditions. And those chronic conditions can be things like diabetes, asthma, heart disease, emphysema, a whole list of things. But we've seen a lot of integration from behavioral health as well. And with that, you know, the folks that are referred from behavioral health, some of them have some mild and moderate mental health conditions, but they may be on behavioral medicine or psychotropic drugs, but their physical health needs haven't been met. They may have a doctor, quote unquote, on paper, but they haven't seen that doctor in many, many years, if at all. So when they get to our clinic, basically we try to assess them physically and make sure that what they're being treated for as far as their mental health needs coincides with a good physical health treatment, especially if they've got chronic conditions. One of the most common side effects to some of the psychotropic drugs that people use is weight gain, and along with that you'll get diabetes, which exacerbates other conditions, for example, heart disease and emphysema. And they've got, in some cases, substance abuse conditions. Maybe they're alcoholics, maybe they're drug users, or they may just have other different conditions that exacerbate their conditions as well. So in addition to that, the clinic is staffed by a nurse that will often do case management, do referrals, constantly calling, and a medical assistant that will assist the PAs and others as well.
So would we be considered a primary care provider?
For these people, yes, we are considered a primary care. I had asked Deanne that maybe in the coming weeks I can provide you a full measure of what we're able to accomplish with these services. In some cases, we've actually reduced the ER use substantially. So folks aren't going to the ER anymore for every whim that they may have had, which that really saves in the community, saves time and resources in the community. And actually, they're getting better care when they're, when it's constructed and coordinated in a manner that we're using as well.
Now, are we growing, seeing more patients?
We are starting to grow and see more patients. We've added another nurse practitioner, Chris Chesney, who's well known throughout the community. She ran the home care at Bay Health Systems and at the Midland Hospital. She's about 2 years ago, received her NP degree and is a certified NP. And so she's bringing some expertise in as well as extra resources. And we're starting to really formalize the way that we do treatment here. It's a good, if I just could say this is a good experience overall because it provides the community and people in the community that would not have or don't have access to primary care with the primary care that they need. It's a good conduit to other services within the community, and it also serves the needs of, we're able to provide some of the NP students and the nursing students and pharmacy students from both Saginaw Valley and Ferris State with opportunities to practice or to learn their practice in a cohesive setting.
And I like that. And our long-range goal is what?
Our long-range goal is to be able to try to meet the needs of the people that we see. So obviously there is a lot more need out there in the community. Currently, the last estimate that we have for primary care providers was one primary care provider to every 1,800 people. And you might think, well, that's not that much. But in comparison to other communities such as Midland or Saginaw, we're far above what their ratios are. In Midland, it's like 1 to 1,100, 1 to 1,200. Saginaw is about 1 to 1,300. We're kind of stuck between a rock and a hard place, though, because in order to receive federal recognition of not having enough primary care providers, we need the ratio to be 1 to 3,000, which is really, really bad. And we don't want to go there either. I mean, we want to be able to try to meet the needs of the people that we have with the available resources that we do. And if that means that we provide care with nurse practitioners, then that's what we're going to do. But ideally, though, is once the grants are done, is that we have a systematic program in place where we're able to maximize revenue through billing, whether it's Medicaid or Medicare or other third-party payers, and also to have that built up enough so that we can subsidize folks that can't pay.
We're getting money from the federal government now.
Right now, the clinic is right now the clinic is transitioning from being grant funded to being funded by through fee for service payment from third-party payers.
But if you were at 3,000 to 1, then there'd be more federal dollars. Is that what you're
Absolutely, yes. We would have what's called a health professional shortage area recognition, and we would receive, we could receive enhanced reimbursement in Medicaid and Medicare for that.
Commissioner Krieger.
Yep. So Joe, before I let you sit down, just to come back to get another question. Further in the agenda, you're looking for a part-time nurse and also for an RN.
Yes.
Are those going to be paid or compensated off the grant money, or will we be able to cover those wages with the billing system that we have? I'm assuming that these are new positions, or they're replacing.
It's replacing an existing position that was originally grant funded, but since the grant ended, we've been able to pay for that position through the reimbursements that we've gotten.
Okay.
This particular funds will help pay for the nurse practitioner services in those clinical areas.
But as time goes on and that grant's gone, their jobs won't be in jeopardy, because we've always had the rule, as long as the grant money's there, they had a position. Grant money leaves, the position leaves.
That's correct. So, and I guess the key thing is we have to maintain enough in reimbursement from third parties.
Very good. Thank you.
Commissioner Begic.
Yeah, just want to mention that the Nicholas Clinic has seen an increase lately too. Now, we did open it up to other counties besides Bay County, so I think they saw 32 last week, 19 the week before, so these, people don't have insurance. So you do take some that don't have insurance, you say also at the clinic there, but generally it's Medicare, Medicaid.
It's Medicaid. We don't really do a lot of Medicare right now. We're in it's quite an ordeal to be certified to do have care through Medicare. Plus, in most conditions, you have to have a doctor on staff in order to do that. But it's mostly Medicaid, but we do see a variety of other third-party payment or third-party payers. The one thing I do want to mention about this, and one thing that we do have to keep into account, is with Medicaid expansion, we've really been able to, through various collaborative efforts in the community, reduce the number of uninsured people quite substantially here in Bay County. We did a telephone survey about a year and a half ago, and we discovered that the uninsured rate was 5%. That's substantially lower than many communities, including Midland, which at the time was about 9–10%. But with the Medicaid expansion, if you remember, there were limits as to how long you could stay on Medicaid if you were through the new expanded coverage. In those cases, it was 4 years. So for those people that have been on in 4 years, and we're going to remind them through various measures and outreach through the community, there are certain things that they have to do in order to stay on Medicaid, and retain their coverage. And one of them is, they've got to get annual physicals. They have to have a health risk assessment done, and that's got to be on file with their third-party organization that they've signed up with. And in addition to that, in some cases, they may have to have co-pays and deductibles met. It's not very much in comparison to what the average person pays in co-pays and deductibles, but if they don't do the basics of getting that annual physical and getting their HRA, they may be kicked off Medicaid, and we don't want to see that happen.
Just a little bit more, we at the Nicholas Clinic, they try to screen everybody for the Healthy Michigan, and there's been quite a few that come through there that do qualify for it, so they do get screened out to qualify for the Medicaid.
And it's been really a godsend in very many cases for a lot of people in the community.
Commissioner Lutz.
So, is there any qualifications to come to the clinic?
Well, not really. I mean, anyone can choose to be. There's no income level or anything like that. If you want to get care at the clinic, you can call 895-2035, get an appointment. If you don't have insurance, we will work with the people to see if they're covered through Medicaid expansion, or if they can obtain coverage through the marketplace. Bay Health Plan helps us with that. They've done a great job. They've signed up literally thousands of people in the last 4 years. and they will continue to do that. But there may be some people, for one reason or another, that either don't qualify or don't choose to get coverage. But even then, we will try, it's in our best interest to make sure that this clinic is sustainable. We don't, other than the grant funds that we're receiving and the reimbursements from Medicaid and other third-party providers, we want to make sure that this is a success. So we really, really encourage people to obtain coverage when it's all possible. But sometimes people just, for one reason or another, they can't obtain coverage. And so we'll try to work with them as well.
So they have to have an appointment to come?
Yes, they'll need to make an appointment. It's not a walk-in clinic. It's not a urgent care center. If you got a broken arm, you really need to go to the emergency room, or if you cut yourself or something like that. This is really, the clinic is designed for people with multiple chronic conditions that need to have physical health and mental health coverage combined.
Kind of wanted you to explain that to the people.
Yes.
So, Joel, the amounts for the estimated totals coming back, they are correct in the resolution. You said 41,000?
Yeah, that 41 should be 51, and I apologize for that.
51, okay.
Yeah.
The other two are correct.
Yes, to my knowledge, yes.
Will you vote on that already? Did we vote? No. We have a motion and resolution, or motion and support, and how about all those in favor?
Aye.
Opposed? Motion carried.
Mr. Chairman,
Yes.
as long as we have our health director here. Joel, I wanted to say, I think, from when Chris and I have been over in the office, and also Mr. Chairman Herrick, it looked like things are going along on the build-out on the
Yes, very, very fast.
compliance.
Thank
So
you.
Has that caused much disruption in providing services for some of the staff or anything that?
No, we've been able to manage fairly well. And as it's going faster than we expected, things are moving faster. And I think the biggest challenge is we're not prepared to move so fast, actually. But we're hoping that by the end of November at the latest, that the entire project will be complete. And, we'll encourage everyone to come and see and take part of.
We're grateful to the board for their help on
Maybe a little open house might even be in order, once it's completed, the construction.
Yes, we will. But don't forget, it's a secured facility, so by the time you come there, you'll have to be buzzed in. So
Thank you, Joel.
you're welcome.
Next up, we have from the Personnel Director, vacancies and new positions. We'll take these all together. Number 1, juvenile home, cook driver, part-time, $11.71 an hour, entry. Number 2, animal control, custodian, kennel attendant, part-time, $11.71 an hour, entry. Department of Aging, kitchen assistant, part-time, $11.71 an hour, entry. Number 4, health department, university clinic, public health nurse, part-time, $22.11 to $25.44 an hour for an RN, $22.28 to $26.15 for a BSN. Number 5, 911, central dispatch, dispatchers 2, full-time, $15.85 an hour, entry. Also, on our desk, we had number 6 from the sheriff. Two officers, full-time road patrol due to the Pink County Township contract, effective as of September the 12th. Road patrol positions are budgeted for the 17 budget, and the sheriff is requesting to be filled in order to maintain adequate staffing. The contracts for that have been signed yesterday, according to sheriff, and when I was out to the township yesterday.
Support.
Any other discussion, questions? We have the sheriff here if you need to know. It's nice to know that'll bring us up to, 36 deputies on patrol now?
Correct.
36, so that's great. All those in favor?
Aye.
Opposed? Motion carried. New positions, B, Department of Aging, case management worker, part-time, $18.85 an hour, entry. B, clerk typist, part-time, $11.71 per hour, entry. What's your pleasure?
Support.
Got motion and support. Any questions? Concerns? All those in favor?
Aye.
Opposed? Motion carried. From the Personnel Director, number 2, reclassification, report and recommendation, seeking committee's receipt of report on approval of recommended reclassification.
So,
Or,
We have motion and support. Any questions, concerns? All those in favor?
aye.
Opposed? Motion carried. From the Personnel Director, item C, Office of Assigned Counsel.
Move to
Oh,
receive.
excuse me, this is from the Office of Assigned Counsel. Monthly report for July 2017. Motion to receive.
So moved.
Support.
Motion support. Any questions or concerns? Mr. Chairman.
Amber, after reading that report, would you say that it's doing what we thought it was going to do when we built that office up, when we built it out, you know, and brought in assigned counsel, or, you know, for the defendants?
It is, I believe that according to that report, if my memory serves me correctly, I believe that there was less than 1% of the cases that were referred to outside attorneys for the month of July, which is what we intended, to keep the majority of those matters in-house. I have spoken with the Office of Assigned Counsel Administrator, and she did indicate she does not have the August report numbers ready yet. August was a much busier month, so both of our felony attorneys actually capped out on the amount of cases that they're allowed to take in August, which happens maybe once a year. So even though it's been busy, they still have managed to keep the amount of cases that they've referred out to a minimum. So yes, I think that it has reached its intended result.
Thank you.
Anyone else? Got a motion and support. Do we vote on this? Not yet.
No.
All those in favor?
Aye.
Opposed? Motion carried. Referrals? None. Unfinished business? New business? Miscellaneous? Mr. Krieger, Commissioner Krieger.
There you go. Thank you. The sheriff's still here, right? If he'd come up a second. I came across an article that talked about the danger our fish have in the Great Lakes in digesting or picking up pharmaceuticals out of the water. And I just wanted to again, make it known to the county that you have a facility that has a container qualified to take prescription drugs. The article talks about a study that was done by Niagara University, and it was pretty alarming the amount of types of fishes that are having issues because of the pharmaceuticals that are being dumped into our systems. The wastewater treatment plants don't have the ability to pull some of these pharmaceuticals out of the water. So I'd just like to encourage everyone to look and see what medicines they have, and before they decide to put it in the toilet and flush it out, so it's gone from them, that isn't what we would like to have done, and that they can physically bring the stuff to you. And of course, they want to highlight with a marker their name and all the information that's on the bottle, but that will be properly disposed of. And I would encourage individuals to take advantage of that opportunity.
Yeah, that's in the lobby, and that's been great. I mean, we're still emptying that thing a couple times a week.
Wonderful.
So there's a lot of drugs that are coming back. So,
Wonderful.
yeah.
Thank you.
Thank you.
I think also, I don't know if it was that study, but I also read that even people with septic tanks, they're flushing this stuff down, it gets into the fields. It not only if it's an antibiotic can kill the good bacteria that's in your septic tank, but again, it permeates into the sand and stuff, and the next thing you know, 50 feet away, you got your well. There you go, you're drinking it, you know, so, yeah, it's a great point. So get the stuff to the sheriff's department. Thank you, Commissioner Krieger. Any other miscellaneous? Commissioner Biggie.
One more reminder about the Gold Star Memorial Ceremony. It's Saturday, September 30th at 11 a.m., Battery Park. It will be the dedication of the Gold Star Family's Memorial Monument. They're still collecting money for it, if you want to donate. They have a Facebook page and they're online also. Hope you all can make it.
Thank you, Commissioner. Anyone else? No other miscellaneous announcements?
I move to adjourn.
Always in order.
Support?
All those in favor?
Aye.
Opposed? Motion carried. We are adjourned.